Hi, I'm Rachel Miller from Empower Physical Therapy in Downingtown, Pennsylvania, and we're here today just to talk about some Pilates-based equipment exercises that you can do to decrease your lower back pain. And as many of you might know, there's 80% of us will have low back pain at some point in our life, so that's a pretty fair amount. So I want to be able to demonstrate and show you how to do some exercises to decrease that pain. One of the main culprits for lower back pain is a muscle called the psoas muscle. And the psoas muscle is deep within the abdomen, is how you would reach it. It runs from T12L1 on the front of the spine down into the front of our hip. And so we can only reach this through the front of our abdomen when we're working with it manually, but it looks a certain way when somebody has tightnesses in this area. So frequently, from a therapy perspective, what I'll see is somebody that has a very tight hip. As soon as they move their leg back, their spine also arches, which is not what we want. So your spine should stay nice and stable, and you should be able to freely move that hip without your back arching at all. So that's one way that I'll look at if somebody's psoas might be tight. This psoas muscle is responsible for either arching the back or bending up the hip. So normally, as you bring the leg back, you should have that free motion in your lumbar spine to bring that forward and back. So if that's tight, we want to get that loose. So now we're going to go through a couple exercises on the reformer. Kate's going to be our demonstrator for this, and I'm going to have Kate lay down here, and she's going to be doing feet in straps. So for those of you who are not familiar with the Pilates reformer, it's a great way that can be either an adjunct to make an exercise harder or easier. I've known a lot of patients that have gotten injured by doing their own Pilates mat exercises, and this is a really nice way to start patients with low back pain to make sure that they're staying nice and stable. So this is a feet in straps exercise, and what we're going to show is that Kate does have a little bit of tight hamstring, so if she comes all the way up high, her pelvis is going to come off of here. We don't want to see that. So we're going to allow her to keep her legs straight, her pelvis in neutral, and now she's just going to be moving her hips back and forth without moving her spine. So take a deep breath in, Kate, and on the exhale, draw the abdominals in and press the legs away. Good. And only go as far as you can where your abdominals stay nice and tucked, and bring it back up towards the ceiling as far as you can without the pelvis coming off. Good. And back down. Good. And this is a nice exercise because, as I demonstrated before, if that psoas is tight, she's going to move as one unit where the back is going to come off and move with the hip instead of it being a separate motion. So this is a great exercise for Kate to be able to work with to get that hip free, and her lumbar spine and her stability and her abdominals is going to improve greatly. Good. Okay, Kate, now bend your knees, take your legs out of the straps, and we're going to come on up into hands and knees so we can do knee stretch. Okay. All right, Kate, I want you to get onto your hands and knees. Hands are on the foot bar, feet are against the shoulder rest here, hips are hip distance apart. I want you to sit back towards your heels just a little bit, slightly curl the tailbone under, shoulder blades stay down and back. I want you to hold this position. Don't let those arms move even a little bit. Tuck that chin and just move the hips back as far as you can without the spine arching, and then back in. Good. In and out. Good. In and out. And just keep folding in. Good. Nice and lengthened. Now, Kate, I want you to show one time what it looks like if somebody's really tight here. So if you arch your back and then straighten out, that's not what we want to see. We want to see a flat back. Otherwise, that's going to make back pain worse. So nice flat back, and hips are just moving in and out as far as they can move with that nice neutral spine. And Kate is looking good here. Very nice. Okay, and come on off. The last exercise we're going to show is the scooter exercise. So for this exercise, Kate's appropriately positioned in a little bit of a lunge. She's going to hinge forward, keeping a very nice, flat, neutral spine position. Her leg is going to be slightly off of the reformer, and she's just going to be bringing her left leg in and out. So no arms yet, Kate, just bringing in and out. And what she's going to be working is that right thigh quad, but she's also trying to get as much length through the front of this hip so that her back isn't arching. Now add the arms in, Kate, and then you can add in running man arms. So lengthening through the torso, making the obliques work. This is very nice. It's called reciprocation, works well to improve somebody's walking. And then when you add in the neck rotation, that simulates a little bit more of a balance challenge, which can be great for this exercise. Beautiful, Kate. And notice how as she lengthens this arm out, she does not arch in her back, which is another thing that you'll see when somebody has a very tight lower back exercise. Perfect. Good.